Welcome to Maximal Being,
a podcast devoted to ditching fad diets and using real science to get you healthy and feeling great.
I'm Doc Mock, a GI and functional medicine doctor who harnesses the power of gut health to get you achieving your goals.
And I'm Jacky P, a well-informed layman who challenges the experts and asks the questions that you want.
Don't forget to hit the subscribe button or leave a comment.
And now, on to the show.
What's going on? Maximal Being's Doc Mock here with MaximalBeing.com. Don't forget to hit the subscribe button, leave us a comment. It does help us to get the word out. If you have any questions, you can email us at team@MaximalBeing.com. Enjoy the episode.
Hello, Maximal Beings. It is I, Jacky P, and I am here with some new friends. I'm not here with Doc Mock. Doc Mock, my heart goes out to you. He's in Tampa. He had to get out of the way of the storm. So sorry, folks, it'll just be me today. So you won't have the big old brain that Doc Mock is. But luckily for us, I've got Dr. Scott Peslak here, who is another big old brain. So we're tagging you in. As well, I've got Kyle Smith, a good friend and a fellow sickle cell warrior. And today we're going to talk about something that is very close to me and impacts my life. Obviously, I've spoken about sickle cell before on the show. But first, I want to introduce our wonderful guests. So first, Dr. Scott Peslak. We're going to go by Dr. Scott. How are you today? And introduce yourself to the folks.
I'm doing great, Jacky. Thank you for having me on the program. It's really exciting to be here and to be able to share this conversation with you and Kyle. So my name's Scott Peslak. I am a physician scientist at the University of Pennsylvania. I see patients at UPenn with sickle cell disease and thalassemia, and I also study sickle cell disease in my laboratory here at Penn. So I've been really fully committed to taking care of sickle cell patients and other red blood cell disorders in my role here in Philadelphia.
Awesome. Appreciate it. Nice to have you, Dr. Scott. And Kyle, if you'd like to introduce yourself to the wonderful listeners.
Yeah, absolutely. Thanks so much for having me, Jacky. I'm excited to be here with you and Dr. Scott. Kyle Smith. I am a nonprofit professional. I work for a corporate affiliated charity, but I also have my own nonprofit that is dedicated to serving individuals with sickle cell disease here in the Philadelphia area, called Crescent Foundation, which Jacky is a board member, and I'm sure we'll talk more about that. But just really looking forward to talking more about sickle cell and, just what's happening within our community, and also how we were able to celebrate Sickle Cell Awareness Month in September.
Absolutely. And thanks for plugging Sickle Cell Wellness Awareness Month. Wow, sorry about that. It's October when we're recording this, but it should be Sickle Cell Awareness Month every month.
Absolutely.
I like to quote you, Kyle, actually at that event. You said, sickle cell should be that default, I forgot what you said exactly, illness in your brain. When people say they think of a sickness, they think of something that needs research for better treatment or cure. Everyone goes to the typicals, right? The cancer, but no one really thinks about sickle cell. Sickle cell is such a, impactful disease to live with. And it is something that even amongst, I would say, the medical field, not very well known. I'm not too sure if you've had this experience, Kyle, where I've gone to emergency room outside of my home city, and the nurse and the emergency room will say, "Hey, so were you born with sickle cell?" Right? And then I know immediately I am in trouble, right? Because it's like I've got to deal with the pain and then also educate the person who's supposed to know how to take care of myself. So,
are you a healthcare practitioner searching for a comprehensive solution to streamline your patient referrals and improve collaboration with other practitioners? Look no further than Rupa Health, the ultimate platform for integrative and functional medicine practitioners. As a healthcare practitioner, I've struggled with the traditional referral process for labs. It's time-consuming, inefficient, and often lacks the necessary communication between providers and patients. But ever since I started using Rupa Health, everything has changed. That's right, Rupa Health is revolutionizing the way that practitioners connect and order lab work with their patients. Their advanced platform allows you to effortlessly send and receive patient lab referrals and secure their information, sending them the kits directly. This makes the communication directly with other patients and practitioners easy to take care of. I can't stress enough how much time and energy Rupa Health has saved me. With just a few clicks, I can easily order lab work and track their progress, and then I receive the results directly into my inbox, which I can send to the patients automatically with recommendations. Absolutely, Rupa Health's extensive network of lab testing and curated, integrated, and functional medicine testing allows practitioners to receive the highest quality of care and dedicate their practice to a patient-centered, holistic approach which aligns perfectly with the values of healthcare in a functional medicine practice. Plus, Rupa Health provides you with excellent customer support. Their team is responsive, knowledgeable, and always helps with assistance in billing questions and how kits are shipped to your patients. They are dedicated to helping practitioners like us provide the best possible care for our patients. And if you're a patient listening, it allows you to seamlessly order your lab testing and receive all of the necessary information. Rupa Health has been a game changer for my practice, and as you know, it will be for yours too. Don't miss out on this incredible opportunity to save on lab testing by heading to labs.rupahealth, that's rupa.com/store/storefront_V as in victory, G as in grape, X 00400. That's labs.rupahealth.com/store/storefront_V as in victory, G as in grape, X 0040. I'll see you later, Maximal Beings.
Let's first, for the folks out there who aren't aware of what sickle cell is, right? I'm going to do something different this time just because this is a little bit unique. I want to have Dr. Scott explain sickle cell, right, in the clinical sense. And then, Kyle, I would love to hear how you explain sickle cell to folks. I know there might be some overlap, but I think it'd be interesting and unique to see the difference. So Dr. Scott, if you want to go first.
Absolutely. Thank you, Jackie. And so sickle cell disease is as you mentioned, an inherited genetic disorder, right? This is something that if you're starting at that point where your providers don't know that is something we need to focus on as far as helping to educate the general public and providers as to what sickle cell disease is. So this is a genetic disorder, and this is a change in what's contained inside your red blood cells. So the red blood cells circulate around your whole body, and their job is to deliver oxygen to all kinds of different organs and tissues throughout your whole body. And the way that it does that is by that oxygen is bound by a protein in the body called hemoglobin. And so normally hemoglobin binds and delivers oxygen. In sickle cell disease, there's a single change in one of the genetic code, the genetic letters in DNA in hemoglobin, that leads to a change in the hemoglobin, at which point, if you have lower amounts of oxygen, those cells begin to form these stiff fibers in the cells themselves, and that causes changes in the shape of the red blood cell that leads to blockages in the blood vessels, something called vaso-occlusion, and it makes the cells a little bit more fragile and likely to break down, a process called hemolysis. The combination of this vaso-occlusion and hemolysis leads to really complications in all areas of the body where blood flows. And so this really is not just a blood disorder. This is a disorder that affects every organ in the entire body. And the primary complication that many people have seen, if you've ever taken care of a sickle cell patient in the hospital or talk with a sickle cell patient, is pain, vaso-occlusive pain. But that's really not nearly the only thing that we see. This really can affect many, many different organs in the body. It can cause chronic neurologic changes, including stroke. It can cause significant changes in kidney function, lead to chronic kidney disease, and even lead to dialysis in many patients. It can lead to degeneration of bone and problems with the hip and shoulder joints, problems with the lung and heart, and even problems in the eye. And so, regular eye exams are really critical for our sickle cell patients as well. So we really think about this as how do we how can we help to change and reduce not only the pain that sickle cell patients face on a daily basis, but also to prevent many of the complications that can happen in organs throughout the body, to help patients really live full lives, and be able to understand how they can modulate that risk through different therapies, to be able to live better and more productive lives as well.
Awesome. So for those listening, you can tell Dr. Scott's been in some medical books, right? He knows, thank you for that, Dr. Scott. And that's a very good explanation of just really the physical, like how does sickle cell impact the body, right? So Kyle, when you're out in the world and you meet someone and they say, hey, oh, you have sickle cell, how do you explain it to folks?
Yeah, I think that there will be some overlap, but definitely, a little more grounded, than Dr. Scott's version. So usually I'll just tell people that, sickle cell is a genetic disease, and how, we all have red blood cells, and there are these circular and squishy discs flowing through our bodies. And I have that too, right? We all have that. But those red blood cells, sometimes when they don't get enough of a particular protein called hemoglobin, that, transfers oxygen to our red blood cells, they become less oxygenated, and those red, circular, squishy blood cells become hard and rigid and, crescent shaped, and, block the blood flow of the body. So understanding that there's a blockage within, our body, there's a buildup of other blood cells kind of flowing, right, which causes inflammation, which then proceeds to cause pain, and kind of goes into the other complications that sickle cell could occur, like stroke, like organ failure, so on and so forth. So that's my kind of like go-to, is just kind of really trying to relate to an individual and have them understand that, the genetics, are the same, except it's just like that difference in terms of we don't get that really crucial oxygen part. That's where things kind of go a little haywire.
And if
Awesome.
I could add to that,
Oh, yes, please do. Go ahead.
I agree. That's a much better way to phrase that. So thank you, Kyle.
Yeah.
And I will say that to add on to that point, one of my mentors always said, if you've seen one sickle cell patient, you've seen one sickle cell patient, right? Every single patient, even though it's the same genetic change that happens, that leads to all the changes that can happen in sickle cell disease, every patient is completely different. And one of the things we're trying to understand as a field and with our patients is how to predict that, and how to give the right therapy to the right patient at the right time. And the way to do that is really to come together between our patients, our community organizations like Crescent, our researchers, to really understand sickle cell disease in a much broader context, to be able to provide the best possible care to our patients.
Yeah, no, and thank you so much, Dr. Scott, for adding that. And I think it's crucial, and something that we recognize, of course, is that this is such an individualistic disease, and there's no one size fits all, which I'm sure we'll cover more throughout our conversation today. So thanks for adding that.
Yeah. That's also a good point too. And also, you can almost interchange sickle cell with almost any disease, right? When we sometimes, human beings, right, we fall into the habit of just like recognizing patterns and attaching patterns to things. And me personally, I've had issues, where I go to the hospital, or I reach out to a doctor and it's pain or something, and it's, oh, well, you have sickle cell. It's probably just a sickle cell, right? And it's in a way, it's not, I don't want to say it's a dismissive. It's just like they feel like, oh, you've got pain in your leg, you've got pain in your joints, right? And sickle cell. And interestingly enough, I've been suffering from gout for years, for 4 or 5 years. I just got diagnosed with gout like over the summer. because finally someone at the ER said, hey, you know what? This might be gout. Let's excruciatingly, right, put that needle in your joint and pull out the fluid. And I've got, which is of course one of the many wonderful side effects, right? We deal with dealing with a sickle cell. But back to how I like to describe sickle cell to folks, is one thing I would say is one thing I really admire about Kyle is that Kyle is very educated about sickle cell. And for better or worse, when I was growing up, um, I had family members that had sickle cell, but my mom kind of raised my brother and I to like think of sickle cell almost as an afterthought. Like take care of yourself, hydrate, eat well, make sure you're rested, right? So you don't get yourself sick. But it was almost something like I would not remember I have sickle cell until sickle cell remembered that, that sickle cell was affecting my life. And I think one, it helped from a mental standpoint, right? Because, one thing that's occurs a lot with sickle cell warriors is the mental health aspect. But it took a long time for me to actually learn about sickle cell and learn all the different types of sickle cell and how it can impact your body. So when up until recently, I used to just tell people that it's a storm, right? And we're talking about the hurricane already, right? It's a storm. I'm like, I don't know when the storm is coming. I got to stay prepared for it all the time. But the storm's going to come. It's going to stop everything. It's going to decimate everything. And when it's over, I got to clean up and hope there's just not a storm coming around the corner soon. And for me, I forget, remind me the new word. We don't say crisis anymore. We say, Kyle, what's the word we use now?
So it's VOEs, right? So it's
VOEs.
vaso-occlusive episodes.
Yes, episodes, vaso-occlusive episodes. So I grew up with crisis, right? Which is when you have pain. So I was moderate. I'd have pain a couple times a year, 4 to 6 times a year. Those would be intense, almost always hospitalized, almost always a week or more. But and we can talk about this now, the different degrees of those that fight with sickle cell. Because for my brother was on the other side of the coin. He almost just kind of always had some form of pain, light pain. He can function, he could go to work, go to school fine. And I was the opposite. A lot of people, they see me, and they wouldn't know until they're like, oh, Jacky, where were you the last couple of weeks? I'm like, oh, well, I just got out of I used to call it a hospital vacation, just because you try to find, you put a flip side of anything. So
are you looking for high-quality, evidence-based supplements to support your functional medicine practice? Look no further than FullScript, the leading platform for healthcare practitioners to prescribe and order professional-grade supplements. As a functional medicine and gastroenterology doctor, I trust FullScript to provide me with a wide range of high-quality supplements that meet specific needs of my patients. Their extensive product catalog includes trusted brands, ensuring that I have access to the best options for my patients' health. That's right, FullScript offers a comprehensive selection of supplements, including vitamins, minerals, botanicals, and specialty formulations, all sourced from reputable manufacturers. Plus, their rigorous quality control ensures that you're getting products that meet the highest quality standards of purity and potency. And what I love most about FullScript is the convenience it offers. With their user-friendly online platform, I can easily browse, prescribe, and manage supplement protocols for my patients. It saves me valuable time and streamlines the ordering process. Absolutely, FullScript makes it easy to create customized protocols for your patients and track their progress. Plus, they handle all the logistics from inventory management to shipping, so you can focus on what matters most, providing excellent care to your patients. So if you're ready to take your functional medicine practice or wellness to the next level, visit us.fullscript.com/welcome/maximalbeing. That's us.fullscript.com/welcome/maximalbeing to receive your 15% discount on customized supplements and check Maximal Being standardized protocols for gut health. FullScript has been a game changer for my practice, and I know it will be for yours. Don't miss out on this incredible resource for functional medicine practitioners and patients alike today.
I'd like to take this time to talk about just the different kinds of sickle cell, right? Because there's SS, it presents itself in a lot of different ways. So Dr. Scott, if you can, in the most layman's terms possible, right? Can I talk about like the broad range of sickle cell, for the folks listening?
Sure. So I think, as many listeners probably know, for every gene, right, everything in your body, there's two copies of everything, one from your mom and one from your dad. So the generally when people hear or talk about sickle cell disease, the most common form of sickle cell disease is what's called sickle cell SS disease, which means you inherited one copy of the sickle hemoglobin from one parent and one from the other, and so that is the medical term for that is homozygous, but essentially what that means is you have two sickle hemoglobin copies in your DNA and all your red blood cells. There's another form of sickle cell disease, probably the second most common form is something called hemoglobin SC disease. So this is that you inherited one copy of sickle hemoglobin from one of your parents, and from the other parent inherited another kind of a change in hemoglobin called hemoglobin C, which by itself, hemoglobin C causes the red blood cells to be a little bit dehydrated, a little bit less fluid inside, doesn't really cause many problems, but in combination with the hemoglobin S, the sickle hemoglobin, can cause either very mild or very severe forms. There's a broad range of severity in patients who have hemoglobin SC disease, much broader than in patients who have SS disease. And so there's a lot of variables beyond just these genetic changes that can affect severity. There's another subset of hemoglobin, something called fetal hemoglobin, that I study in my lab, and many people are trying to understand if we can develop new drugs to increase this protective form of hemoglobin that some patients, for reasons we don't really understand yet, have higher levels than others. There are many social and environmental factors that can play into this as well. And as Jacky mentioned earlier, the psychologic aspect of any chronic disorder is a major key factor in determining responsiveness and therapy and how people live at a day-to-day basis. And so this really does play a significant role. And many programs, including ours, have embedded psychologists within the program to be able to provide mental health support, which is really critical. And so I think there's many different things that can play into the changes and the severity that we see in our patients. But one of the primary ones that we do look at is what that genetic change is with sickle cell disease.
Thanks for breaking that down, Dr. Scott. And and one thing that's important about sickle cell, right, is I have a friend who is a sickle cell warrior, and he wasn't diagnosed until 18. So it doesn't always very obvious present itself early on in life, or sometimes it just can go misdiagnosed. So it's important to understand and realize that folks can get checked, right? And we've kind of discussed this before, when we had that panel a couple weeks back about educating the community, right? Educating people and that's medical and non-medical, that you can have sickle cell. It's possible you can have sickle cell and not even know, and you're dealing with the side effects, you're dealing with the pain or other problems that come with it without knowing, like, hey, without having that official diagnosis. So I'd like to talk a little bit about just like the care side of sickle cell, because of course, like everything, there's a spectrum. You can be like myself or like Kyle, who we very well aware what we have. We're on top of it. We're lucky enough to be in a very good hospital system that takes care of us. But that's not always the case, right? So, Kyle, if you can share some of your vision, you've done a lot of this at Crescent, but what would you say are some of the, I would say, maybe hurdles or obstacles that you've seen in our community that you're trying to address with Crescent, and how it's impacted our wellness overall?
Yeah, sure. I think so. I want to go back to one thing you said as well too before addressing the care. I think that it's important for folks to know just their, as I like to call it, their status, in terms of whether or not they do or don't have carry or a carrier of the sickle cell trait, right? I think that this is super important, especially when it comes to larger life decisions like family planning, and how that could really impact, whether or not you could have a child with sickle cell, right? And I think that, it's a common belief that sickle cell is a quote unquote like Black disease. But, as we talked about, as Dr. Scott said earlier, this is a genetic disease. There are people who, of course, here in the US, primarily it impacts people who are Black and of African descent. But, there are Mediterranean folks with sickle cell disease who, present as a white Caucasian presenting, right? And there is also a large sickle cell population in India, right? So it's just a genetic disease that impacts everyone. And I just am very passionate about folks just understanding whether or not they are carriers of the trait. You can go to your primary care physician, ask for a hemoglobinopathy to see whether or not you have sickle cell trait. And, that's simple. So simple blood test. To talk more about the care, there are so many directions that I could go. But I think that just understanding the history of sickle cell is super important, right? When it comes to care. I was born in a year when been sickle cell screening had just been mandated at the hospital that I was born at in 1989. So was fortunate enough to, be diagnosed at 3 weeks. Unfortunately, that's not the case for everyone, as you said, with your friend who was 18 years old, right? During that period of time, physicians were still learning more about sickle cell disease and really just trying to get us to live into our adulthoods, right? And weren't really focused on what life would look like once we became adults, right? So unfortunately, there was no true preparation in terms of like what that care could possibly look like. And unfortunately, since there are, a lot of vaso-occlusive episodes that are a symptom of this disease, which just causes, incredible amounts of pain. The primary treatment for this symptom is opioids, right? To help with the pain, deal with the pain. And understanding that, unfortunately, a lot of patients have to enter the emergency department to, try to get care for when they are having these VOEs. Knowing that opioids are the primary type of treatment, unfortunately, there is a large stigma when it comes to individuals living with sickle cell disease of being drug seekers, right? And so these labels are, of course, unfair and biased as well. But again, this is the treatment the only treatment that we've been given for the symptom of our disease, right? So what I have been trying to do is really re-envision what a new world or a new care model would look like outside of sickle cell patients entering, the emergency department. Because when we think of emergency departments, and a VOE is 100% an emergency, but that doesn't necessarily mean we need to go to the emergency room, right? We are, whenever you enter an emergency room, you are classified in terms of like how high your emergency is. Is it level 1, 2, or 3, right? And if you are entering, a sickle cell patient is entering the emergency department, they probably will take a back seat to the gunshot wound that just came in or the stabbing that just came in, so on and so forth. And unfortunately, this just, they are still really suffering and pain and also not being monitored for any other complications that could occur from that crisis too. And it leads to really prolonged waits for treatment. And I'm talking 5, 6, 7, I've heard 20 plus hours before waiting to be seen in the emergency department. So with something that we've been working on with Penn Medicine is trying to really expand hours of what's called a infusion center, which is nice, where you can go in one day, any time between, excuse me, you can go in one day, Monday through Friday from about 9 to 5. If you're having a crisis, and you can get IV pain medication and also IV fluids, up to 3 doses. If those 3 doses really don't touch your pain, then they will likely admit you, right? And you will get the whole like workup like that. But these types of, infusion centers, or I guess kind of different routes that are really, circumventing the emergency department, are huge for our community, because it lessens the weight that you'll have to undergo. It lessens the stress that you mentally will put yourself through, because you're thinking like, hey, I don't want to be labeled a drug seeker. What do I have to wear to go to the emergency department? What should I put on? I don't want to be, labeled a malingerer, because, not everybody believes my pain is real, so on and so forth. So these types of, I guess, off ramps outside of the emergency department are huge. And, Dr. Scott has been really helpful in trying to dream along with us, and looking forward to like trying to really expand those hours, because as you know, Jacky, sickle cell, and I like how you formed it. You said it's a storm. The storm doesn't have a set date and time, right? It doesn't just
Yeah.
happen Monday through Friday between nine
Yeah.
to 5. Right. So yeah, that's something that we're trying to address when it comes to the care. One thing also too is that not everyone has where they are what we call a sickle cell expert, right? Dr. Scott Peslak is what we call a sickle cell expert. Not everyone has that. Maybe they just have a hematologist, and hematologists are great. They're wonderful. They know about sickle cell, but they are not sickle cell experts. We need individuals to have some type of medical home where they are seeing a sickle cell expert, so that their individual disease is fully being addressed. Because like we said, this is not a one size fits all. There are many complications that go along with this disease, and it really presents itself in so many different ways. So I'll pull up there, and
Yeah.
yeah.
No, I appreciate you sharing that, because I think, we haven't talked to ourselves, Kyle, but like I'm sure you have a story. I mean, I don't know anyone who's a sickle cell that doesn't have a story. I have friends in Philly who say, yeah, when I'm in pain, it's 2 a.m. in the morning, and I'm in like 10 out of 10 pain, I literally get dressed up. I put on my work clothes just because it might help me get a little bit more empathy from the nurse when I need pain medicine, so they don't think I'm a drug dealer, right? So, these are the things that uh, sickle cell warriors, I like to use the word warriors because we are, have to deal with, right? No one breaks their arm or has a cold or feels ill in most demographics of illnesses have to ever worry about what they look like when they go and look for care. They just go and look for care and expect to be taken care of. And, there's a lot of things to be said about that. But, that's one thing I do appreciate about you, Dr. Scott, is that you understand that and you realize that. And if there's anything that you can comment on, like, if we're waving a magical wand, or be like being visionaries here, like, what would you like want to see, or what do you think are some actionable items that, maybe someone who's listening that isn't in our fine town of Philadelphia, where like these changes are being done, but like, what do you think are some steps that can be done in those different, cities and hospital systems out there?
Yeah, great question. Thanks, Jacky. Yeah, and I appreciate your perspective on that, Kyle, and thank you for the kind words as well. I think so. A couple things just to comment on Kyle's points, and then I'll get to that point as well. I think the emergency rooms is, I would say, sickle cell patients do not want to come to the emergency room. Nobody wants to be in the emergency room, right? It's a spot where it's kind of the last resort in as far as care. And so you're absolutely right in that we are working. I can tell you we're working very hard with the ER at Penn to try to improve time to care. We take a lot of steps back post-COVID, but there's been a lot of progress. I just had a meeting with a very talented second-year medical student here this morning who's also very passionate about sickle cell patients, and we're working to do quality improvement here at Penn across the Penn medicine system, and this is happening throughout the country. So it's a long process, but there are a lot of people that are really engaged and that are committed to improve care. In the meantime, though, we try to avoid going to the emergency room. So models like day hospitals and infusion centers really are critical and have been shown to be standards of care across the country. And I'm very proud of our team here. And I think that really one of the most critical parts about a infusion center is that there's a consistent team who knows what sickle cell disease is, how to take care of patients. We have individualized care plans for patients. And I try to avoid the term pain plan because it's not just pain, it's everything else, right? It is truly a comprehensive care plan that we develop. And that really can be done in many centers, but is best done in a comprehensive sickle cell center with a team. And we are looking to expand our center and many others, but the key part to do that is to get more young people and providers engaged in sickle cell research and clinical care, and so, what you're doing, Jacky, with this podcast, and what Kyle is doing with the Crescent Foundation, and what we're trying to do as well, is to try to improve visibility and improve excitement about caring for our patients and continue to do research in this field. I think that and your analogy earlier about the storm, I think, is a really apt one, and one that I use very commonly with my patients. I say that if the storm surges high, right, and you even have a little wave that comes up, that can be devastating for patients. And if you can lower the overall height of that storm surge and of the ocean, even if you have some waves, it doesn't get to a point where it's a full vaso-occlusive episode. And so there's different ways to do that, but one of the main ways is to think about disease-modifying therapies. That there's been a lot of excitement in the field. This is what I study in lab, and one of the main ones we've used for many years is a medicine called hydroxyurea, which helps to make the stiff sickle cells, as Kyle mentioned before, more full and more round and more flexible and floppy to be able to pass through the blood vessels more easily. But there's many others that I'm happy to talk about here as well, including gene therapy, which is very exciting, and new therapies that are coming out of the clinic. I think, though, beyond just saying we should develop new therapies, I think the key part is understanding what sickle cell disease is at a broad level nationally. There has not been historically national registries of sickle cell disease to understand in a population level how patients do with which kinds of therapies, how we can predict who's going to do better, who's going to do worse, who needs more intense therapy and who maybe doesn't. And so there's been a lot of efforts from national organizations, including the Sickle Cell Disease Association of America and the National Association for Sickle Cell Centers, in addition to the American Society of Hematology, all of which are working on national registries to better understand sickle cell disease in patients that now are doing great but need better and more defined care plans as they age into their 40s, 50s, 60s, 70s. That's something that I think is going to be become one of the most important things to be able to solve as a sickle cell community. And we can do this by sharing knowledge and sharing information across the country in many different care settings, many different populations of patients to better take care of our sickle cell community.
Awesome. Yeah, thanks for sharing that, Dr. Scott. Yeah, and I think that is one thing that we should strive for as in the sickle cell community, is just a greater just permeation into just a common knowledge of, I mean, even just the basics of the sickle cell like existing, right? I was in Orlando, Florida. Speaking of Florida, I was sick, and then that was the instant of like, oh, sickle cell, and like, where you're born. So like, okay, the nurse may or may not have even known what sickle cell was on a very basic level. So the education and awareness is very important to make sure that we can move further the cause. But we are going to take a quick break to come back here. I've been talking with Dr. Scott Peslak and Kyle Smith, and we will be back in just a second.
The content included is not intended to be used as medical advice, and viewers should consult their physician or healthcare provider should they have additional questions. The The viewer should not rely on information contained in these presentations for immediate or urgent medical needs. Additionally, if you think you have a medical emergency, call your physician or go to the emergency department or call 911 immediately. Never disregard professional medical advice or rely on seeking medical care or delay medical care due to information contained in this presentation. What's going on, Maximal Beings? Doc Mock here. If you haven't done so already, leave us a comment and hit the subscribe button. Let your friends and family know. That way we can get the word out and continue to bash the bro science.